5. The symptom and desire. In Lacanian discourse, the subject's desire is always mediated by the desire of the other. Symptoms emerge as the effect of a conflict between one's own desire and the expectations, norms, and prohibitions imposed by the other. Example: anxiety symptoms may arise from the subject's impossibility of aligning their desire with the symbolic demands of their environment. Formula: the symptom is a letter that always arrives at its destination, an unconscious message addressed to the other. 6. The symptom as a rupture in the symbolic order. This is of particular significance for psychotic structures. Lacan showed that psychosis is the result of the foreclosure of the name of the father from the symbolic order, i.e., the absence of the fundamental instance that introduces law and limit. Manifestation: intrusions of the real in the form of hallucinations, delusions, or feelings of external control. Example: in paranoia, the symbolic structure collapses and the real begins to speak directly. 7. The symptom as repetition. Lacan integrates Freud's concept of the compulsion to repeat. Symptoms are not merely accidental, they often function as cyclical returns of trauma. Essence: the repetitiveness of the symptom is an attempt to work through that which remains unresolved. Example: a subject who continually enters destructive relationships repeats an unconscious scenario rooted in childhood experience. 8. The symptom as part of subjective structure. French psychoanalysis conceives of the subject through three fundamental clinical structures: neurosis, psychosis, and perversion. Neurosis, symptoms, phobias, hysteria, obsessions are linked to the conflict between desire and law. Psychosis, symptoms, delusions, hallucinations result from the collapse of symbolic support. Perversion, symptoms manifest as specific scenarios of jouissance, sadism, masochism, functioning as ways of maintaining subjective position. Number 9. The symptom in therapy. In the French tradition, the task of analytic practice is not so much the elimination of the symptom, but rather its rewriting, integration, and subjective appropriation. Key concept: jouissance, a particular form of enjoyment linked to the symptom. It cannot be fully eliminated, but can be resignified. Clinical examples: Little Hans. The horse phobia is interpreted as a symbolic defense against castration anxiety. Hysteria. Symptomatology functions as an appeal to the other, a demand for recognition of subjectivity. Conclusion: in French psychoanalysis, the symptom is not considered an accidental deviation from the norm, but a fundamental mode of the subject's existence in language and in the structure of desire. It is simultaneously the expression of conflict, a mechanism of compensation, and a way of organizing psychic reality. The symptom always indicates the limit of symbolization and opens access